Hello and welcome everybody to the U.S. Open Health Desk presented by Mount Sinai. I am Mal Washington, your host, joined by Dr. Melissa Leber, Director of Sports Medicine at Mount Sinai Hospital. Dr. Leber, welcome. How are you today?
Good, thank you for having me.
I am glad you're here. Are you enjoying the U.S. Open?
I am, it's great so far.
Today, if we could, we want to talk about that idea of complete care as it pertains to athletes. Whether you're a U.S. Open athlete or someone who plays tennis on the weekend, the more you play, the more susceptible you are to injuries. Talk, if you would, about that idea of complete care as it pertains to athletes.
Yeah. Well, a superstar athlete is not made overnight. It's the hours and hours of hardcore preparation that really makes the difference. So when people like to talk about overuse and overtraining syndrome, because number one, no one wants a setback from an injury, and number two, athletes are getting better and training harder every day. So if you progress your training too quickly and too rapidly, your performance can actually decline, which would lead to overtraining syndrome. If you actually repeat the same exercise every day and don't change it up, you actually can get an overuse injury. So the best thing you can do is change up your exercise every day and progress your training load slowly.
In business, we talk about efficiency, and certainly from an athlete standpoint, and me as a former player, I was trying to get the most out of my training and all of my off-court training.
Yeah.
What can athletes do? What can tennis players do to get the most effective training out of what they're doing?
The best thing you can do is change up your frequency, intensity, and duration of exercise every day so that your body never gets accustomed to any one training routine. The more you change it up, the more effective your training routine will be.
And speaking on that same vein there, what can athletes do in preparation to prevent injuries? Because right here at the U.S. Open, I guarantee you, every single day, someone is going to get some type of injury. What type of things can they do?
We underestimate the importance of strength training and a resistance training program. I think in general, we like to run on the treadmill and go on the elliptical, but those are really cardiovascular exercises. If you can work on a good strength training program and really focus on specific muscle groups in terms of strengthening, it'll help prevent injury. And the other benefit is that a resistance training program actually boosts your endurance. So it has a double-edged sword there. It's good.
If you think about in this championship so far, we've seen some of the hottest temperatures we've ever seen in a U.S. Open. What is the best way and what things can an athlete do to recover from these type of heat conditions?
Well, in terms of recovering from heat injury and heat illness, certainly doing an ice bath and preparation is key. So recovery is going to be easier if you prepared more effectively with hydration and proper nutrition. From first point on, having an ice towel on your neck as much as you can whenever you change sides, that's beneficial. The other great thing for recovery is, say you have an injury or you have pain or anything like that, the best thing you can do is actually not stop exercising, but continue exercising, just changing up your routine a little bit, so that way you don't lose all your strength and endurance that you developed before, but you take that injury in account and just change up your routine so that you have time to recover from that pain or that injury.
A moment ago, you mentioned the ice bath, and I know that Novak Djokovic, after the third set in his match, and I'd never heard of this happening during a match, he went off of the court and he and his opponent went to the locker room for a few minutes, jumped into an ice bath. What is the purpose of that?
Well, basically, you get a fresh body. I mean, you feel fresh if you bring your core temperature down and you run into the locker room. He and his opponent both did it, and it was smart. They actually cooled down, came back out fresh and ready to play the next set. And so there's a huge benefit in terms of your recovery and muscle recovery as well.
When you talked about injuries, when does an athlete know that they are ready to return to play? Because a doctor, you might tell someone, okay, it'll be 4 weeks before you get back out there. Every athlete, they're looking to push that to 2.5 to 3 weeks. When do they really know they're ready?
It depends on the injury, so always talk to your doctor. But in general, you should be pain-free, have minimal to no swelling, and not tender when you touch that area. Some injuries you can push harder and go back quicker. And then that's for really returning to your training program. In order to return to match play, you should really be back to your pre-injury endurance level and also have good neuromuscular control depending on that injury.
Dr. Leber, thank you for your time and your expertise.
No problem. Thank you for having me.
Make sure you check out usopen.org for more from Dr. Leber and the staff at Mount Sinai. Until next time, thank you for joining us at the U.S. Open Health Desk, presented by Mount Sinai.